David has seizures, and he is developmentally disabled. And we put him in the bathtub, and I had nobody there but myself. And he had a seizure, and he's never had a seizure in the bathtub. And so I just had to keep stretching his neck to so there was no water, but I know water got in. So our son came home, David lifted himself, we got out, and he ended up laying on the bedroom floor for a while and not breathing well. And so I got scared and thought we better bring him to the hospital. And so we did, and brought him in right away. They got him taken care of. The doctors were so good, because what I really liked, and probably because of my age, years ago, maybe doctors didn't listen as they do now, and the doctors we had listened to me, and I changed my mind about something, and I asked our RN to go get the doctor to bring him back in, because I had decided that I didn't want David overnight, because he's really not very cooperative. And I know he'd be pulling all the wires, and it just wasn't, he was responding to whatever we were doing. So that was just so good. I was just so impressed that they listened to me and David. They get him antibiotics and prevented pneumonia, and did a great job with that. And so then 2 weeks ago, today actually, I had an episode of very severe pain at my work. And then our son brought me into the emergency room, and again, they were very attentive, and didn't want to do all the extreme tests, but I just needed them, and they found out I had some gallstones and a pretty, perhaps nasty looking infected gallbladder. So the next day, and they were not pushy at all. They just said, if you want to have this now or if you want to wait, you can, but we decided to have the surgery the next day. So I stayed in overnight because they thought in case I would have another episode, it'd be really hard. And they gave me wonderful medication, and I slept comfortably, and everybody was super good. Like, everyone just listened to me. That's the main thing I would say that I was very impressed that everyone listened to what I was saying. And because I am David's guardian and his advocate, they did listen to me, because I really do know him best, and they appeared to believe that. So that was very positive and good. So, yeah. So it was just the ease, and that they listened to us, especially because, as I said, David can't talk, and they maybe could tell me what they think is better than I would want, and they didn't. They really listened to me and trusted how I take care of him, or how he is. So needs to be cared for. It was the timeliness, the quickness, and the concern that it was done very fast, and I appreciated that, because emergency is an emergency. It's not like you can wait 5 hours. I don't know if I could have bared my gallstones for 5 hours, actually. And for David, it was because of the breathing. I thought these things needed to be done immediately. So I think that your mission statement is it ought to be. That's how I felt: well cared for, well listened to, well received. I think that because I had changed my mind, and I felt actually quite embarrassed about that I told them, no, I don't want him to stay overnight. I don't think that we need to do all these extreme things. I think he's getting better, because we were there about 3 hours and just kind of observing him. And that is what the time when I thought they listened to me, because I actually know him, and that they thought, this is okay, and you can always come back. If it doesn't work out, you can come back, but if you think he's going to be okay, that is fine. So that I was very impressed with. And even when they said, for me, you don't have to have the surgery right now. If you want to think about it or come back, you can. I just couldn't believe I was presented with that. I mean, partly because I was really hungry and I wanted to eat something. They were like, you can go home, and so all the choices were before me. You can stay, you can go. David, you can stay, you can go. I was so impressed with that, and I just thought that was something that I had never experienced, because usually they say, no, this one gets you done, this one you get done, and no choices in the matter at all. Well, we had an incident with our son that is disabled, that has a seizure disorder. He had a seizure in a bathtub. Got him out of that, but he could not breathe very well and very concerned about it. So we brought him to the emergency room, and right away we got in. The nurses were there, but then the doctor came in quite quickly and was assessing him, and just was listening to me, like, what is he like? Is this normal? We're like, no, this is not normal. There's something wrong. And they did end up taking some x-rays and checked to see if he had any water in his lungs. They can't always see it. They didn't think they saw any, but to precaution, they did decide to do antibiotics, and they thought perhaps keep him overnight. We decided And then he left, and they did some blood workup, and I wasn't comfortable with that decision, so I asked them to come back. And as I said maybe before, but I was a bit embarrassed about that, but I thought, no, I really do better. And he had been getting better, because it was about 3 hours we were in the room. And the doctor said, no, that's okay. If you think this is how he is, if this is getting normal, that's fine, because you can come back and just take the antibiotics. Just make sure he doesn't get pneumonia. So I was just quite impressed with that he listened to us and that we could make the choice to go home. What I experienced here was like a dream. Like I thought, this is how people should be treated. It's even affected me at work, like, just the attentiveness and the listening to a patient, that it is really critical in how they perceive that the care is given and actually received. Because if you don't think they're caring, it's not going to be listened to the patient really well. I had never had nursing assistants or NAs in the hospitals I've been to, and I was even telling my husband, I thought, oh, they were so good, because when I needed to walk, they could come help walk with me. And I like your little telephones that, like, something happened, or that they could talk to someone very quickly and get help, or if I couldn't, because I couldn't get out of bed without attaching all the tubes, that someone was there within a very short time. And again, that timeliness is probably going to keep coming back to. I think it's really critical how a patient feels about their experience and about their choices for healthcare, and that they just, because you want to get better and get moving on fast. So those are really important points that I really like, that there's nursing assistants. The nurses actually talked to you too. They weren't just always rushing around. They actually gave you a little time and talked to you, not just about your health, but just as a person. Everyone wants to be known as an individual person. So I appreciate that. And I really had a great experience with everybody. They were just fun. They constantly asked me, in fact, I told my husband, they were saying, is your pain level high? Are you comfortable? Do you need anything? Every person actually did, even the nursing assistants to the nurses. I don't think the doctors did, because they're, they don't come in for that. But I bet every time they left, and they'd come back even, oh, I'm sorry, do you need anything? Or are you comfortable? What's your pain level? I was just amazed. I did tell my husband that, so I was like, wow, they were like really, really, really super attentive that way to what I was feeling. And even just that I wanted to get up and take a shower, or, take a walk. I liked that I could call someone and that they would walk with me for the first 24 hours. So I like that. That was a great experience.